Welcome back to Health Law Pulse, the podcast where we explore how healthcare, leadership, and law intersect in the real world. I'm your host, John Rhodes, healthcare attorney and founder of Health Law Counsel, LLC. Today's episode is a little different and focuses on a part of healthcare that doesn't always get the attention it deserves, but it has a direct impact on overall health, access to care, and long-term outcomes, and that's oral health. My guest today is Kendra Flowers, a healthcare leader with deep experience in clinical operations, compliance, and advancing access to care in the dental space. Kendra has worked across large-scale organizations, mobile and school-based care models, and innovative programs designed to reach underserved communities. In this episode, we talk about what access to care really looks like in practice, the role of technology like teledentistry and AI in expanding that access, and how operational design and compliance intersect in delivering care at scale. We also explore health equity in the dental space, what's working, what's not, and where there's real opportunity to improve outcomes. I'm glad you're with us. This is Health Law Pulse.
Kendra Flowers, thank you for joining us on this episode of Health Law Pulse. Really appreciate you carving out some time to chat with us.
Yeah, of course. Always a pleasure.
Well, perfect. Well, Kendra, your expertise is in the dental space. I haven't done an episode yet in dentistry, so this will be we're making podcasts Health Law Pulse histories here today. So, very excited to broach this topic. I do have a number of clients in the dental space, and I think it's really a really important issue where we'll talk about compliance and I mentioned on a episode recently that the purpose of this podcast was not necessarily to always cover compliance, always to cover legal issues, but I want to talk about healthcare delivery models, access to care issues, operational issues, things like that. So big issues in the dental space. And so I'm excited to cover these topics with you today. So, I mean, first off, I would love to just hear a little bit about your background, what got you into healthcare, what you're doing now, and we can go from there.
Yeah. How I got into healthcare, long story, won't bore you. Didn't know that's what I wanted to do. Just knew I didn't want to work at Taco Bell for the rest of my life. So knew I couldn't be a nurse. So to all those nurses, hands down and applause. So that's where I got into dental. I just happened to fall in love with dental once I became a dental assistant. And then I knew I wanted to spend my time there. And I've been clinical chair side. I'm a dental hygienist by trade. I have a license. Moved into education and then into clinical operations for DSOs. And where I met you was in compliance in the Walmart world when there was Walmart Health, and so back into clinical operations, and now for the first time a nonprofit. So really, that focuses on health or oral health equity and access.
Excellent, excellent. Thank you for that. And so I love to start. I'd love to start with what you're doing in the technology space, and we can go from there into access to care and things like that.
Yeah.
You're working with models that include teledentistry. I'd love to learn more about what that is. AI-enabled imaging, saliva-based diagnostics, things like that. How are these actually changing care delivery on the ground and not just in theory? First, before we even get there, do you mind just giving us a little rundown of what is teledentistry? What is this AI
Oh,
imaging and all that stuff?
yeah.
And then we can go from there.
So I will say dentistry for all of your healthcare listeners. One is healthcare. So I'm glad that you have me on here and that we're finally having this conversation together. It definitely is a two-way street and they impact each other. But it's very similar, right, to telehealth. And so I know that there's different
Right.
versions. There's, talk therapy and urgent care and all the different things. But teledentistry is essentially that. And so there could be different models where it's your own dental provider that's having a conversation with you, and dentistry has really come a long way. It used to be, right, just texting. Maybe your dentist or calling them or sending them a picture. COVID definitely streamlined that process to create more regulations and rules around teledentistry. And they have both sync and asynchronous, and so now they have things like it says AI imaging. And so you're able to take a photo with your phone or your tablet and just either upload it or have a live video with your dentist. And depending on the state it is, they're able to establish you as a patient and be able to diagnose from those types of things. And they also have another model where you might have a workforce that is out in the field or out in the community that's taking x-rays and images and then sending that back to the dentist. So there's a few models there. Yeah, and then AI imaging, again, is just where you're taking an image or a photo or video, and you have a platform that is reading essentially the image itself, and depending on where it is in the level of approval, it might be providing a diagnosis to the dentist or just flagging something that's seen. And they also have that for x-rays as well, just like on the healthcare side. I will say that this is maybe one area that has been adopted by dentistry more so than healthcare, surprisingly, very quickly. They've embraced it, which has been great. And then there's saliva-based diagnostics or testing, and that's something that's definitely newer and lagging in dentistry. So just like healthcare, you do laboratory work to be able to figure out what's going on internally. Dentistry has been behind in that. So they're upcoming companies that are now looking for biomarkers, different types of bacteria, different readings from the mouth that will tell them one about oral health and even about overall health. So those are just a few things there.
Things. Yeah, no, I
Yeah,
appreciate you giving educating me about that. And
yeah,
the reason I asked for the education is because I don't know that I've ever been offered this by my dentist, right? I don't know that I've ever been offered whether synchronous or async uh, capability to call in or to have some sort of face-to-face virtual visit. How you mentioned there's quick adoption. Is there certain populations that is adopting this more than others? Uh, how is it actually changing care delivery in the dental space?
yeah. I would say the AI imaging or AI for radiographs, that is definitely, even my private practice dentist is using a platform now. And I only knew that because I know what it is, right? So you might not be aware, they might not be letting you know that they're utilizing this technology. But we are definitely seeing that in higher end practices in the DSO space, so corporate dentistry for those their healthcare systems. And so we're seeing that because it's able to just provide additional support, case acceptance for the patient themselves. Uh, but I will say with teledentistry, that is definitely pockets of population, more rural areas. Where I'm seeing it having a bigger impact is a public health space,
Hmm.
because they're limited funds. And so I really think that the whole reason why I love innovation is that I think it does have the potential to change health outcomes or oral health outcomes, and not in the way that we have traditionally been doing it. We know it's not working. We know even in healthcare that these rural underserved populations don't have the same outcomes. They don't have the same services and access to care. And so if we can do things differently than we traditionally have done them, I think we can make true systemic change. But teledentistry is one that also there are some issues. Well, it always goes back to compliance and legal, where there's, state practice acts or regulations or laws that have prevented even dentistry from being able to do this. So even where I live in Georgia, teledentistry, the regulations were just passed last year. So they technically, except for during COVID, couldn't practice teledentistry. There were no regulations around it. So there are some states that are definitely more progressive. There are reimbursement challenges. There are in at least in dentistry. There's little to no reimbursement, especially for our government payers. And so some of these things have just been challenges and barriers to implementation.
Yeah, so you hit on two things that really immediately came to mind. Number one, the reimbursement issue.
Mm,
Sh- Uh, I mean, I think for public programs, it seems, and correct me if you think I'm wrong, but
yeah.
for public programs, it seems like just getting coverage can be a challenge, right?
Oh,
Funding issues. And so, let alone teledentistry, which is, I think, kind of a new concept in this space, relatively speaking. So I have to imagine even on both on the public program side and the commercial side, I can see how reimbursement would be an issue. And one of my questions was going to be, what are you seeing in terms of the biggest impact, real world impact on these of these innovations? It sounds like real rural access, kind of the rural health. Yeah, people who don't have immediate access to
Uh,
care, that's probably where we're seeing a higher impact. Yeah, extent that these some of these barriers that you're mentioning aren't completely prohibitive.
Exactly. So I think, why I love what I love right now in the nonprofit space is that's literally why we exist. So we want to be able to serve as what I call invisible populations. So those in the nursing homes, those that don't have a dentist or even a healthcare provider within, a 3-county radius. Dentistry doesn't solve that problem, but I think it's at least an initial progress step. And so at least they're face to face with the provider. At least they can hear outside of Google and TikTok and everything else of what's going on in their mouth. And so I call it triaging. And so just like from the public health space is what can we do? What's the most good we can do with the least amount of resources? And so if we can help to guide our patients or potential patients to where they need to be, I think that that's key because they don't know where to start. I am overwhelmed in the healthcare space and I know what I'm doing. So I can only imagine for those that don't have the typical resources, they don't even know where to start. And so even with some of the patient populations that we work with, so the adult IDD populations or senior citizens, the caregivers say, I don't know how to get them the care that they need. Where do I even begin? And so I think teledentistry and at least the partners that we've worked with have a care coordination piece tied into their consultations. And so it helps to get them set up, right? You're never going to get rid of brick and mortar, at least not in the next 100 years that I can imagine, for, fixing teeth and providing the cleanings and things. But at least we can get them to the right place, guide them.
And I assume that, well, two things. You brought up a great point. This sounds to me like one of those situations or one of those issues that um, where the sort of the legal landscape, it may be a step or two behind the technology. And you mentioned
Oh, yeah.
passing laws just a year ago. I suspect that and I don't know, but I suspect that many states uh, maybe don't even address teledentistry. Correct me if I'm wrong, uh, or they're just now discussing it because it's just it doesn't seem like it's really on the front page of any
Yeah,
of the publications that are out there on healthcare.
I would say Georgia was one of the last remaining, and I don't have exact either, but I know COVID definitely pushed all of that, and they had to create some emergency rules and regulations, and then post-COVID, they were able to turn them into something more permanent. But you are correct. So even what we see is that there's no alignment, even on the standard of care of what's establishing a patient of record. So I can go across state lines and I can be established as a patient of record with a dentist, but I go next door to Alabama or whatever. And I can't. I have to see the doctor first physically, and then the mid-level provider can see me. And so even just having that non-standardization is difficult to be able to implement, I would say, systemically.
And that's helpful. That was something that I learned as well. So,
Yeah.
uh, real quick, just on teledentistry, I assume that it's largely a mechanism for evaluation and diagnosis and care coordination, right? So
Yes.
obviously you can't like replace a crown or whatever.
Yeah. Yeah.
Over
Yeah. Yeah.
teledentistry. So it's sort of evaluating the problem, right? In
Yes.
making a diagnosis and then saying, okay, well, we need to see you, and let's make an appointment. Really trying to push that next step in care. Is that accurate?
It's accurate in different models. So I think if you think about the urgent care model, what do we need to prioritize in your mouth? Yes, you definitely need to come in. Oh, you need to go to the ER, whatever that looks like. But I think the model where you may be serving out in the community, it actually, you could do some preventative treatment or even some, basic restorative care, depending again where you live. But you could provide that if you have the dentist able to provide a diagnosis and a treatment plan. In some cases, you actually can do the services there without the dentist being present. So I think when you have the ability, it's just like telehealth, right? They can cover maybe not mental care, but you can cover a few different platforms. And so that cuts the costs of labor down, reduces that transportation and the hours traveled. And so I think there definitely is something there. Again, we are also, as I'm sure healthcare is struggling with workforce challenges. In my previous roles, our bottleneck was actually the dentist. It wasn't auxiliary staff, because dentists can only supervise so many. They only want to travel so far. And dentistry is a little bit different. They're the only ones that can make any type of diagnosis. So you're kind of stuck in there. So if we can think outside that box, how do we make them more efficient? Which is also why I love AI. How do we make them more efficient and really allow them to work at the top of the scope of their licensure? All staff, it just makes us more efficient as an industry.
Excellent. That's really interesting. So we've touched on these innovations, these technology driven models in the dental space. I want to talk a little bit about access to care, which I think that to a certain extent, these innovations, at least theoretically, should help with access to care. We talked a little bit about rural health
Yeah.
populations and how they may not have immediate access to dental providers as those, that live in the city or, live in areas where there's abundance of dental providers. And it makes me think about health equity a little bit in the dental space. And the way I think about it, without being an expert in this space and sort of just kind of looking at it as anyone else would, it seems as if there is a larger gap in access to care and in health equity in the dental space than there is in the rest of healthcare. Is that a fair assessment? And if so, why
Yeah.
is that the case?
Yeah, it's a fair assessment. And the way I view it and why I'm so passionate about it is it feels like to get the care that you need, you have to have the money, right? It feels inequitable because it is. So when you think about this, even for adult benefits, Medicaid benefits or Medicare benefits, it's state to state. So you might have, maybe you have an x-ray and an extraction and an exam that you can have once a year, all the way from preventative services and more advanced care. And but you have this in between middle America as well, where they are choosing between healthcare, possibly their medicines. You think about the seniors, they have a limited income. So, well, I need my heart medicine. I'm not going to be able to go to the dentist. Or there's an education piece where they just don't understand how it is all connected. And we saw the same thing, right, with optometry. Optometry, vision, dental is all considered this specialty care that's outside. We need to eat, shouldn't be in pain. We don't want infection. We need to see. Hearing, same thing. So for sure. And I think this is what I'm seeing, and I've cautioned this message, is that we saw a huge rise. A report just came out. We saw a 60% increase in emergency room visits for dental care over the last few years. It is coming back to the taxpayers anyways, but we aren't covering and we aren't preventing. And so they will find a spot. If there's no dentist, if they don't have the money, they go to the ER. We've known this for decades. But I think that also our large corporations, they're focused at the top 10% of income levels because that's who has the money and the buying power and who can afford, you know, full crowns and cosmetic care. And so there's a great book, by the way. If you've never read it, I am a weirdo that passes them out. It's called Teeth by Mary Otto. And she's a journalist and talks about why there's such a big inequity in America and what happened. Why are we different than the rest of the world? And a lot of it is political. But it really happened when we separated dental and medical, when we disconnected them as that, well, it's not important here, so we won't include it in any of our even, government payers. We're just going to keep them separate. And so we are definitely seeing that, and it's getting worse and worse, and the divide is getting larger.
Yeah, Kendra, that's really interesting. I appreciate that book recommendation as well.
Yeah.
Look at that. And I have a number of friends who are dentists and clients. I suspect that if I asked them, and I think this is correct, and especially in the kind of coordinated care um, world that we worked on together in a past life,
Hmm.
that if you ask them about dental care and its impact on overall health, I would think that they would answer that it, dental care can be a window into many other health problems,
Oh,
right?
yes.
And
Yeah.
so it is interesting to me, why isn't there more coordination of care between dental and medical and it- and there, I guess there is, but it's forced, right? And it's very expensive. Your
Yes.
statistic about emergency care is an intriguing one in that whether it's medical in nature or dental, if it's if a patient is experiencing an enormous amount of pain or health issues, they're going to end up in the ER, and it ends up being a medical issue,
Yeah.
right? So it's always been interesting to me that there is that divide
Yeah.
between medical and dental when really um, you need more coordination to be able to treat the whole patient, the whole health,
Yeah.
in which oral health is such a huge part of that.
Yeah, I think a lot of it has to do, and I learned this when we worked together. Optometry was very similar, is that it's very privatized. So private practice, private practitioner, until probably the last decade or so, where now we have what we call DSOs, dental support organizations, or like MSOs, what you all have in medical. And so that started to shift. But you have to think about too, there's not a lot of private practitioners or even DSOs that take government payers because the reimbursement level is so low. And I have been there. It is near impossible to break even, if not losing money, seeing these patient populations. And the last year or so, it's actually gotten worse. And so, it's either Medicaid benefits have been lost for adults or they're all being rolled back. And so you're seeing mass exodus from government payers, but even commercial payers because they're tightening on reimbursement. And so there's this fine line of you have dentists who, and I understand this issue as well. You have these dentists who graduate nowadays with, three to $500,000 in student loans. How do you pay your bills? How do you do this? And so that's one reason I didn't go to dental school. I did not want those loans. I knew I would be tied down. And so when we say we have a broken system, every single part of our system in dentistry is broken and it only serves certain people. So even dentists that are in private practice or serving the quote general population, they don't know what's going on out in the rest of the world and in rural America and these underserved areas. And I've tried to make this message clear because I hear it a lot. And I think actually health care professionals understand this more, is that they're not, people are not choosing neglect, they're choosing shelter, food, medicine. This is just something that has come down until it's an issue. And then if it's an issue and I still don't have money, ER. So I think these are the types of things is we have to fix this. And in my mind, that's where it goes back to innovation. What can we do differently? What we're doing is not working, it's broken.
Yeah, and that's super helpful, Ken. I appreciate that insight. I mean, it strikes me as there are probably a number of contributing factors that could maybe provide a solution, right? Obviously, funding is a huge one.
Yeah.
Operational issues, solving for operational gaps. There's the legal landscape that allows for the facilitation of these new technological innovations, um, which raises um, compliance risk with anytime you
Yeah.
introduce new technology, there's compliance risk, and you mentioned that you're dealing with this is a problem I have with uh or I've discussed with many clients that have 50 state uh
Oh,
telehealth companies or 50
yeah.
state organizations. They're dealing with 50 different
Eh,
sets of rules, and it makes it really complicated. What risks, as we think about the technologies that you've already discussed and educated us on, what kind of risks should organizations be thinking about from a compliance perspective
mhm.
as they adopt these technologies?
I think knowing what your regulations are. And so a lot of times I've heard similar, like, oh, but you can do this or that's okay. Or, my doctor does that. Medical and dental are very different, and state to state are very different. Even your practice setting is very different. Public health and dentistry seems to have different regulations and limitations compared to private practice. That's a whole nother conversation we'll have to have for another time. But but it's very. I think that's the piece. Know your regulation, because if not, you'll get yourself in trouble, especially with government payers.
Right.
It's not worth it. And then also do your due diligence. Like, make sure that they have all of the HIPAA, privacy, security, um, policies in place, that they have my husband's in IT, and the amount of hackers and everything else that's happening stresses me out. I don't know how he handles it, but to make sure you have your liability insurance in place, or that they have their liability, and you yourself, because essentially you as a provider become responsible. But I think the other piece we really have to think about, especially when it comes to teledentistry, is, and this again could be a whole conversation, is because you have established your patient provider relationship, y- we have to think about, is it just becoming a checkbox now, right? So have we seen them, and then we never get to the point where we've provided actual care or the continuity of care? So who's considered this provider for this patient? So I think that's also another piece. And for dental, I think medical is buttoned up documentation. Absolutely, documentation, especially with new technologies. I think about saliva screening or testing. I mean, it's there's very few companies, and like you said, it's very new. It's niche for the most part, and so your traditional reviewer or whoever that is might not even know what it is. So you want to make sure you're documenting everything very well. And again, there has always been that concern, is that the more information you gather or you find out, the more liable you become. So maybe I missed something in my imaging, and maybe it was a cancer or first sign of heart disease or whatever that looks like. So you just want to make sure that you're well trained as well, on whatever innovation that you're providing to your patients.
Yeah, that's helpful. I mean, so many, so many. Yeah. When it comes to compliance risk, um, and that's yeah, and it's just the challenges of operating in multiple states uh, are there are a lot, and so it's always something to consider, both on the medical side and the dental side. Um, that's helpful, Kendra. I want to shift gears quickly to quality.
Oh,
About compliance risk. We talk about, some of the technological innovations and access to care, things like that. How do you ensure consistent quality of care when using these types of models? So a decentralized model or a technology-enabled model. What are the keys to ensuring consistent quality of care in those circumstances?
yeah, this is a loaded question. Because overall in dentistry, because it has been so privatized,
Mm.
I feel like quality oversight is lacking. I will say for corporate or the DSO setting, because you do have a large support system, I do believe that the quality has been raised, just like, a healthcare system would have their review team. So I think those are two different beasts. But personally like to build quality into anything that I do. So even at the nonprofit that I work in, I want to make sure that there's checks and balances that, within our own protocols, did we make sure that they followed through with a referral? Did the patient call the referral? I mean, we can only do so much, right, to get them there, but did we make sure that nothing was left behind? And then same thing, if you have the ability, well, I would say a lot of the dental platforms are obviously FDA approved, so there's a lot of quality built in. So I think that's a really good key to these technologies to make sure that they have whatever clearances or certifications or approvals that they need to operate in. I have seen a few come out, um, maybe pre-market. And so I think people just have to be very aware of what you're signing up for. And I feel literally every single day there's a new AI platform, whether it's for billing or documentation or X-ray. So I think that's where I went back to do your due diligence. Make sure you're implementing something that you legally can do. And if you do that, most likely you're going to have the quality built in to where you need to.
Yeah, those are some great points. And I don't mean for this question to be rhetorical at all. I am interested in your point of view in terms of protocols and training in these types of models, these AI or teledentistry, technologically driven models, if I can say that word. Uh, what role did those play, protocols, training play in making those innovations successful?
So funnily enough, I have just started a company. I joined forces with one of my close friends and now business partner, and this is what we do. And so I have seen at least in dentistry, that there is a gap between the clinical education and the systems and protocols. They've built a great product, right? It works very well, but how does it work in the real world? How does it work in the office? How much time does it take? What does the provider need to know or not, right? Especially when you get to the AI piece and all the engineering. And so I think that it is important. And so if it was me being a private practitioner without a big support system, I would probably lean into a product or a software platform that already has that built out, or they have some type of onboarding or clinical implementation specialist. So we're seeing some of these larger companies that are adopting that infrastructure. But with your smaller companies, startup emerging technologies, more than likely, you'll have to figure it out yourself. And so I would make sure that your team, if you're the dentist, to make sure your team understands, you can use it in this way, or you cannot use it in this way, or, it maybe, I mean, there's been lawsuits already with AI use happening without patient consents in dental from a pretty large organization, one of the biggest in the world. So it's just important that you know how to train your staff and yourself.
Yeah, interesting. Helpful. I didn't realize that about your venture there. So that was fortuitous. I appreciate the insight
I
on that.
know. Good job.
Okay, I want to shift gears. Last topic here, forward-looking, future of oral health and access. What, Kendra, gives you optimism about the future of oral health access?
I instantly went to not. Okay,
Be positive here.
let's be positive.
Hmm.
With chaos comes innovation.
Okay.
I'm going to go back just a little negative to come positive.
Sure.
Oral health infrastructure is being dismantled. There's no CDC oral health division any longer. If you didn't know this,
Hmm.
they're gone. We now have had 3 state dental directors are gone because of budget. There's a lot of free clinics, uh, public health clinics that have closed that I've personally worked with because they've lost federal funding. And then we're losing reimbursement levels. So we're seeing, and now, whether or not you believe in fluoride, but we're seeing that being removed from the water. And so we are gearing up for a tsunami of dental needs. And I'm not exaggerating this, and we won't know because we have no surveillance happening. So, with that, I am hoping that people are out there and they are trying to figure out the best way, maybe even to re-innovate our oral healthcare system. I think this is our opportunity because with nothing being in place, we can start making what we think should be in place. And maybe that's teledentistry. Maybe that is, providing more mid-level practitioners, which we don't necessarily have in oral health. And so that's as you know me, John, I'm not always the most positive, but that's what I'm hoping comes from all this chaos.
Kendra, that was really interesting. I appreciate that. Yeah, I mean, there's some of the things you mentioned that I did not realize. Appreciate your educating me on that. Well, you've already answered this. I was going to ask you if you could change one thing about how dental care is delivered today, what would it be?
Patient first. Everyone says it, but I don't see it. Um, I don't see it. I don't see in the way that it's delivered. Um, Let me walk that back. All patient centered.
Yeah.
I want to see every type of population represented and focused on. And a lot of times, all I see is I get it, is where the money is. Um, but again, we're going to hit a tsunami of senior citizens, the baby boomers, um, underserved. It's just, I think if we all do a little bit to take care of everyone, it will help at least maybe stop the bleeding a little bit, prevent these people from hitting the ER. Because any dentist know there's very few offices, or I'm sorry, very few emergency rooms that have an oral surgeon or any type of dental provider. So we know they go there to just get antibiotics and maybe pain medication, but the problem's never solved and it just keeps recirculating. So I think if dentistry does their due diligence or do process, they do what they're supposed to do, that'll be helpful. And what I will say too is I think that healthcare, good or bad, I know they hate the mouth, and that's okay. We don't like the body. They're gonna probably have to be pulled into to help with this because it's going to be too big for our industry to handle.
So, yeah, when I think about one thing about, one change in how dental care is delivered, I'm thinking increased integration. You and alluded
Yes,
to
yes, yes.
integration between healthcare, uh, okay, healthcare, not healthcare, the medical
Yeah, yeah,
side,
yeah.
the dental side. Um, because yeah, I mean, it seems like I'm not a clinician, but it seems like increased integration between the medical and dental side could be a window into really better overall healthcare for patients. And, uh, on the healthcare side, maybe a window, or on the medical
Yeah,
side, be a window to dental issues and vice
yeah,
versa. Um, but it's
yeah.
easier said than done. I mean,
It's been slow. It's definitely, I think, at the forefront at a lot of the large dental organizations and vendors and manufacturers. It's coming, but nobody's figured it out because of everything we've talked about for the last 40 minutes of all the different challenges you have. No one has really figured it out, but I'm seeing more and more movement towards figuring it out and really making it happen. And so the one thing that will probably happen and dentistry has pushed back is more regulation on dentistry. So if you notice medical, right, they had to do certain things because legally they have to. Dentistry has been the Wild West. I mean, just to be honest, we used to say that all the time in our previous life. It was just the Wild West. And so I think that is going to really push that integration and even what I've discovered and so all of the medical community, you guys have been great to work with. You've been good champions of your patients and dentists and dentistry has kind of dug their heels in a little bit. And so I think it's worth saying, and John knows me, I'm a pretty honest and open person, is that it takes both of you working together. It takes everybody working together. And again, that's why I say put the patient forward. It's not a he said, she said, I'm a doctor, I'm not a doctor. I've heard all of the arguments. I don't care. We're there to serve the patient. And that's all it takes.
That's what it boils down to on
Yeah.
all sides of healthcare is
Yeah.
what's the best interest of the patient and what clinically makes sense for the patient. That's a great way to end this. So, Kendra, this has been really helpful. I want to every episode I end with a lightning round. Just going to ask you three quick questions.
God. Okay.
and it'll be quick. But as I talked to you before, and I've mentioned before on this episode, this is a sponsor segment on the Health Law Pulse, and is brought to you today, as every episode, by Western Associates. It's a company that helps organizations create high quality branded merchandise and corporate products that people actually want to keep. And I am wearing a Western
Oh,
Associate quarter zip right now. If you're watching on my YouTube channel, I'm sort of holding it up there with my logo on it. It's a high quality item.
yeah. We always knew John as the most fashionable one there.
Yeah, I'm rarely accused, if ever accused, of being fashionable. But Western Associates has helped
Yes.
in that department, which is
Yes.
an area I need a lot of help in. So if your organization is looking to elevate its brand, um, please contact Western Associates. They are a great organization to work with, westernassociates.com. You can contact Mike Eldridge, who is a rep over there, ELDRIDGE at westernassociates.com. And we'll also include a link in the episode description if you are interested in learning more. So Kendra, three quick questions, lightning round questions. First thing that comes to mind that would immediately improve access to dental care.
Being a scope of practice for all that are licensed.
Okay, big push there. That makes a lot of sense. Would it really help with the kind of those healthcare deserts as well in terms of access?
It might. You'd be surprised. You want to know how many hygienists and possible dental therapists that will go to these areas? A lot.
Oh, okay.
Yeah.
But they're limited in their scope of practice. Is that what you're saying?
Yes. Yes, yes, yes.
Okay. Of the three that we've talked about, which will have the biggest impact in dental care? Teledentistry, AI, or preventative diagnostic?
I want to say AI because I've already seen it.
Okay.
I mean, even small practices now have AI and everyone's using it in some way, whether it's answering the phone now, billing, x-ray, I'm everything. So for dentistry anyways.
Yeah. So
Yeah.
clinically as well as
Oh, clinically, absolutely. Yes.
or those administrative duties or
Yes.
responsibilities that each practice has. That makes a lot of sense. And finally, show that you're binging, podcast you're listening to besides the Law Pulse, or book you are reading right now.
Your Friends and Neighbors.
Is that a TV show?
It's a TV show, Apple. It's with John Hamm.
I think someone just recently mentioned that to me as well.
It's pretty interesting. Yeah.
Okay, excellent. Well, thank Kendra. This has been so incredibly enlightening. We should have done this a long time ago. I appreciate you educating us on some of these dental issues. And I really appreciate it. So three takeaways for me uh, from our discussion. Health equity requires intentional design. It's not
Yes.
just going to happen.
No.
Innovation expands access, but requires guardrails, as we discussed. And access is an operational challenge. It's not just a clinical issue,
No.
but access and integrated care between medical and dental requires some real operational insight and thoughts to make that a reality. So um, this has been really great. I want to thank Kendra for her great insights, carving out time today to spend with us. And I know have a very busy schedule. Appreciate your insights with us today.
Yeah. Thank you. With one of my favorite lawyers ever.
Oh, well, that's I appreciate that. That's not many people say that. So, no, I joke that no one calls a lawyer just to say hi. It's usually when they need something. So the fact that
I know.
I appreciate it. All right,
Thank
Kendra, this has
you.
been great. Really appreciate it. Thank you so much for your time.
Okay.
Take care.
That's it for this episode of Health Law Pulse. If you enjoyed today's episode, I'm going to ask you a favor. Please subscribe, leave a review, share with a friend. We are on YouTube, Spotify, and Apple Podcasts. You can also find these links to my episodes, to all the episodes on my website at www.healthlawcounsel.com. Thank you for tuning in to Health Law Pulse. I want to thank Kendra also for her time and sharing her expertise in what I think is often an overlooked area of healthcare. This space is often talked about at a high level, but not always understood in terms of how it actually works. At the end of the day, expanding access to care isn't just about new technology. It's about how intentionally we design the systems that deliver it. Thank you, everybody. This is Health Law Pulse.